Hi, it's Dr. Shelley. And so today is exactly 10 days away from 1 full year of the Ngn Nclex exam. But this video is for those of you who have failed this test. Yes, you just failed, like you just failed. And before you do something crazy and Looney Tunes, I gotta grab you and help you because you're gonna pass. But here's the thing. This video, like I said, did you just fail? Now what? We're going to give you 10 quick tips to prevent you from failing again, but stop right now. Don't do anything else before you listen to this video. So here we go. Do not reapply to take that test in 45 days. I pray you didn't do it already. Some of you do it so fast, I can't even catch you and stop you. Here's the thing. When you reapply to take this test, some of you are confused because they send you this little report that says you can reapply to take your test in 45 days. That's the minimum you could retake your test. But I tell you this, I've been around for 20 years teaching this, and I've been in nursing 40 years. Those people who take a test in 45 days fail it 100% of the time. Do not retest that soon. You know nothing. You don't know any more than you knew 45 days ago. And planning how to study is going to take a little bit longer. Yeah, that's the key. Do not apply. In fact, don't put that pressure on yourself. Just take a minute and think, what did I do wrong? How can I make it right? And don't even pay for this test yet, because then it's going to put pressure. One of the things too that I've noticed is that I've had students where they just graduated a year ago, and because they took it every 45 days, they've taken this test 6, 7, 8, 9, 10 times. Here's the deal. I got a news flash for you guys. If you keep taking this test, and I certainly definitely want you to know that after 3 failures, you're getting dangerous here, because when you keep retaking the test is going to be harder. Why do I say that? Well, it's not that it's literally harder. It's that you have now used up so many questions in the test bank that they don't have a choice but to give you some newfangled crazy shit that you've never even heard of or saw before in your life. And so the first test you take is the easiest and most representative of a new graduate just coming out of school. But then you keep taking the test and you're using all the questions in the test bank. It's not like they have an unlimited supply of test questions. No, there's a finite number of questions, and you are barreling through them. I mean, and now where are they going to get more? Well, they're going to go way deep in the test bank to find those questions that nobody's ever seen in their life. And so you don't even get the benefit of having seen this before on your school exams. All right, so that's number 1. The other thing about it is the more you take the test, the worse your scores get. I want you to challenge me on this. If you're smart, every candidate report that you got after failing the test, you kept it. And a lot of times when you call me for a consultation, well, you don't really call, but you text me for a consultation at 216-410-0936. You text me, you want this consultation, it's $30, $40, and you send me your $35, $40, and then we do a consultation, and I ask you to please send me those candidate reports that you got after you failed. And I analyze them with you, and I show you how you just got worse and worse and worse and worse and worse. You didn't get better, because what's happening again is the more you test and don't really do a whole lot different, or you think you did something different, and maybe you'll find out today that the different that you did was wrong. The more you test, the harder the questions get, because they are the rarest questions ever given, because now you've already, and they're not going to give you repeat questions. So you've already answered the easy questions, test 1, 2, 3, and 4. Now you're on test 5. Things get a little rough, so remember that. Okay? Understand how many questions you had when you failed. Oh yeah, don't get that twisted in your mind and forget what it was that you failed at. Because you could fail anywhere between 85 and 150 questions. You could fail at 130, you could fail at 90, you could fail at 150, you could fail at 85, you could fail at 86, you could fail at 149. You could fail anywhere in between 85 to 150. But here's one thing you better know. If you failed in 85 questions? You killed everybody on your test. Like, they're so dead. I can't defibrillate them. I can't do CPR and bring them back. They're dead. Nobody can bring them back, okay? Because you killed them all. What does that mean? That means, think about it. This is a test to test for your basic safety in nursing. And within 85 questions, they could tell you weren't safe in nursing. They throw out, 15, 20 questions. They just throw them out. They're pilots. So that means you killed even fewer people faster. So that's why I said it's important. And I'll always ask you when you call for consultation, well, how many questions did you get? If you tell me 150, I already know what kind of student I'm working with. I know that if you failed in 150, you were this close to passing, and I don't have a lot of work to do, and neither do you. It may make the difference on whether or not I tell you you need a review or you really don't. It may make a difference in whether I tell you you need a comprehensive package or you just need pink packets. It makes a difference because you have the knowledge base. You were just kind of like not quite mastering it yet. And that's my job, to help you master this process. And don't forget, I put my entire nursing school on YouTube for free. There is more than 400 videos for free on every subject. So we're going to get you there. Come on, stay with me. Read and understand the candidate report. Please don't throw that away. Please, if you didn't get it, call the Board of Nursing. That is their obligation to you, to give you a candidate report and show you what the hell did I screw up in. When you get this candidate report, it's going to have a list of the subjects in the test plan. They are right here. Now, you don't have to memorize this or anything else. I'm gonna make sure that you can see it. And I'm actually gonna come a little bit closer just so that you can see what I have typed. Now, hang in there with your girl, because I'm not the best. But this is the test plan, okay? So if you look at the test plan, you basically see management of care, which is coordinated care for the LPN, safety and infection control, health promotion and maintenance. Then you have psych, basic care and comfort, pharmacology, reduction of risk and physiological adaptation. Now, here's the thing, guys. I read those to you because I really want you to know what they are. I really, really, really want you to know all about those categories. So here we go. Let me just fix this phone a little bit. Y'all know I'm challenged. Okay, here we go. So your management of care is who you see first: delegation, ethical, legal, advanced directives, informed consent. It is your workplace conflict, your SBAR. It is your making assignments, your charge nurse responsibilities, your staffing concerns. It is your who you see first, prioritization. So prioritization, delegation, ethical, legal, workplace conflict, SBAR, therapeutic communication, non-therapeutic communication. It's all of that. It's everything that you might not even think of as a nurse coming out of school that is going to affect how you run your life every day of the week. Okay, so that's what management of care or coordinated care means. If you're an LPN, it's going to say coordinated care. Remember, this is damn near 20% of your test. So if you get bad score in there, well, you know, you and me, we're going to have to talk. Okay, safety and infection control. Well, here's the thing, guys. Safety and infection control, those questions have increased. This Ngn Nclex decided, because you were acting so retarded and not like an intelligent nurse during COVID, since we had so many nurses that lost their damn mind and was sharing Facebook fake news and on Instagram just lying, didn't know they were lying, but they were sharing fake news because you weren't thinking about basic science, but you were just part of the rumor mill about vaccines and about infection, and you just kind of lost your mind. Meanwhile, back at the ranch, the doctors didn't lose their mind, the nurses lost their mind. So the less education you had, actually, the more likely you were to get in trouble with COVID, infection, and all this nonsense. So they decided, since nurses lost their mind during COVID and was passing out fake news, you know, sharing it on social media, because they follow you too, honey. We're going to go ahead and put more of this on the test because you're clearly uneducated about it, okay? So the new test has more of that on it. How much more? Well, there's a full 13%, and that could make or break you. Now, Health promotion and maintenance, that is the one that most people have no idea what the fuck is that. That's your maternity, your growth and development, your pediatrics, your geriatrics, in other words, your older patients, your cancer screenings, your vaccines. That's what health promotion and maintenance is. It's 9%. It is not an area of high failure. It's just not. Seems like you guys kind of halfway like it. It's just not your focus necessarily, but you can fail in it, okay? And then there's psych, basic care and comfort, and farm. Psych is in a class all by itself. Psych is the one subject, if you really think about it, that the NCLEX exam pulled out, separated, segregated, and put on your test in a whole category by itself. They didn't take cardio, they didn't take GI, they didn't go down there and get respiratory, they didn't go over there and get neuro. No, they took psych, because crazy people are on every unit you get on. If it's the NICU, the parents are crazy. If it's OB, the poor mother may be suffering from postpartum depression. If it's neuro, ortho, I mean, it's just crazy folks are everywhere. So psych is a big one. And I will tell you this, if you were not born in the United States, you are considered English second language. That's just a label. It doesn't mean anything. It's not demeaning. It's not saying you don't speak your 6 or 7 or 8 languages even. It's saying that the first language in your ear was not English from the American side of the map. So what that means is that you have a higher failure rate in psych. You just do, because it doesn't make sense to you. Even culturally speaking, women don't speak to men the way they do in America, in other countries. So the approach you may take to a male patient would be totally different in your country versus ours. So it's a cultural thing. Psych, high failure rate, English second language. Basic care and comfort, well, you know. Before the test ever changed, basic care and comfort was a really high. In fact, I'll give it, for the last 20 years, it was the #1 area of failure. Now, I give you a video on this. I just give you a whole video on this, so you ain't gonna have to worry. But I'm telling you, it's a focus area. But now, with the new test, we've had a whole year of analysis. It's not #1, it's tied for #1. You'll find out what the #1 area of failure is in a minute. When you look at the pharmacology, that is another focus area. In pharmacology, they see what's happening throughout the country. They followed, just like you and I did, Redonda DeVault. Remember how we followed that girl who had been a nurse for 3 years, and she was told to give IV, 2 milligrams IV Versed to a patient that she had taken down to radiology for a scan, nuclear medicine for a scan. And then when the patient got down there, she also took the patient, she was in attendance with the patient the whole time she was down there. And the doctor wanted the patient, who felt like they were claustrophobic, getting all nervous and anxious for the scan, she wanted her to have some Versed, which, as you know, is a benzodiazepine. This experienced nurse of 3 years goes to the Pyxis, and truthfully, the only reason why she killed this patient is because she didn't know the generic name for her medication. So the medication name for Versed, the generic medication, she didn't know that name. So when she went to the Pyxis machine, she put Versed. It gave her nothing. So she thought maybe I misspelled it, so she put VE. Well, that brought up vecuronium, which is a paralytic agent in ICU to keep you from, kicking your trach out of your throat. And she gave that paralytic agent that has also been used for capital punishment in the past. She gave that paralytic agent to the patient. She didn't know her pharmacology with regards to the name of her drugs, but then she didn't even know what to do with the drug that she thought she was giving. Because if you're going to give Versed, which the generic name is midazolam, if you're going to give Versed, you have to give it over 2 minutes. If she'd only given it over 2 minutes, they could have rescued this patient, but she just pushed it in and walked on up and out back to neuro. And so what happened is this lady was shoved into the scan and was literally coding and couldn't tell anybody, because paralytic agent paralyzes you, your voice box, your respiratory, everything. You're getting paralyzed from the head down. Yeah, so what did they do? They put more pharmacology on this test because they see that there are many nurses, not just her, that are doing things that are showing basically a direct correlation to, you don't know your drugs. Now, pharmacology is 16%, and I'm telling you, it went up in number. So you kind of got to focus on those generic names and know what the hell you're doing, okay? The next one is, yep, you guessed it. What color is it? Bright red. What color was basic care and comfort? Dark red. It's kind of taking a back seat, but not really because it's kind of tied. This reduction of risk, bright red. Oh my God. It is all your procedures. It is everything. It's eardrops, it's eye drops, it's dialysis, it's Foley catheters, it's IVs, it's central lines, it's how do you give, it's medication administration, it's EMG, it's EEG, it's TTE, it's TEE, it's everything. MRI, CAT scan, Glasgow scale, log rolling, everything, even diets and restraints and just everything. Your trachs, your vents, your chest physiotherapy, your incentive spirometer, your meter dose inhaler, your blood administration, it's everything. All of this is being failed repeatedly. And I will tell you this, before the new test came out, they did a big old survey of what are nurses screwing up the most. You're screwing up a lot of procedures. You just don't know what to do and how to prepare patients for these procedures, okay? Now, physiologic adaptation, it's kind of confusing. I'm going to try to go there with you, but you may not really understand it until, you really look into it a little bit. But physiologic adaptation is understanding the why and the how something happened. So usually when I'm talking to a student on the phone with their consultation for $35, $40, when I talk to them, they say, oh, I got a big below in physiologic adaptation. What is that? I'll say, okay, well, let's try one out. Let's just give you an example. And I may say, what causes cirrhosis? And they may say, alcohol, of course. Some people don't even know that, but some people might know it, and they may say alcohol. And that isn't the part that's the physiologic adaptation. The physiological adaptation comes into where I ask you, okay, during a patient's during your management of a patient with cirrhosis caused by alcohol, what would you say would be the typical complications that the patient could experience? Or I'll ask them, what causes the ascites in the patient with cirrhosis caused by the alcohol? And they don't know anything about portal hypertension. They don't know anything about the role that albumin plays in keeping fluid in the vessel. They don't understand portal circulation throughout the liver. They just don't. So that's an example of how physiological adaptation is kind of like, a failure area. But again, remember what I said. This is the biggest part of your test, management of care, coordinated care. So of course you would want to go to my playlist and find for free your management of care, coordinated care playlist and watch all of that before you go take your test if this was your area of concern. Safety and infection control, you would want to go to the playlist on safety and infection control. Health promotion and maintenance, you got to kind of learn my maternity, peds, growth and development, geriatrics. For the psych, easy psych, right? Basic care and comfort, I hooked you up with a really wonderful video on that. Pharmacology, I have a pharmacology channel, playlist, if you will, inside of HETV. You'll see it all. And again, remember that HETV means Health Education Television, because we have so many people that follow us that aren't even in nursing school because they want to know about their health, and I give it straight to you, right? No chaser, straight, no chaser. Okay, the reduction of risk, basic care and comfort, pharmacology, they are trouble-making areas for you. You already know that. Now, let's remember something else about the candidate report real quick. Here we go. When you get your candidate report, because you got to get that, you have to, you're going to see aboves, nears, and below. Most people get aboves in the second half of the candidate report. Where is that? That is the section that says clinical judgment, and everything underneath it is recognize cues, analyze cues, prioritize hypothesis, generate solutions, take action, and evaluate outcomes. These are your case studies. Do me a favor. Let me tell you what to do since I've had a year to analyze this. Stop studying case studies. You don't need no help in case studies. 99.99% of you, because I look at you every day, I see you every day, I read to you every day, I consult with you all the time. You don't need help in case studies. They're the easiest part of the test. No, your behind need basics. Stay over here in the basics, because this right here, this is where you get all your aboves. That's what I've seen. Now, what do you do when you get an above, a near, a below? I've had people tell me they almost passed because they got all nears. No, boo, you did not almost pass. You know who almost passes? The person who gets all aboves and one near, or all aboves and one below. Now, I will tell you this. When you get your report, if you got more than 3 belows, you need a course. You need to start over. You need to be educated. You need to go back to school. Not really, but you need a course. You need a review. You know what I'm saying? You need everything. You got more than 3 belows. Just 2 or 3 belows is bad enough, but more than 3, oh, come on now. We got to get this together, okay? If you get a below, here's what it means. It means you missed every single question that they gave you in that subject for the most part. If you have an above, it doesn't mean don't study it. It means for that time frame at that point with those questions, you got them all right. With a near, the nears are really weird because they gave you questions in a certain area and you got those right. But the minute they increased the difficulty in the question, you got it wrong. You was like, bye, Felicia, I ain't got time for this. I don't know what that is. Where you coming out of woodwork with that crap? So if they increase the difficulty, you don't do very well. If they dummy it down, you're good. That's not close enough. So you get a near passing. Okay, so that's that. Stop working so much. I ain't gonna keep going on and on with y'all about this. You need to cut your work hours to no more than 24 hours a week. And if you do have to work more than that, because I did, then don't expect to study for this test in the next 6 weeks, 8 weeks, 10 or 12, and go take it and pass. Slow your road, because your priority right now, because you have to, and it is what it is working and making money and paying your bills. Well, then make sure you understand you really should not be applying for a test anytime soon, because you ain't finna get this done anytime soon. You too busy working. You will need double the time as a person who really can go and reduce those hours to 24 hours a week. Okay. Next, evaluate the nursing school. I am really shocked at how many people don't know that they went to an asinine, stupid, ignorant, horrible, horrifying nursing school. Like I ask you, well, was that a good school? You say something crazy like, yeah, they was real good teachers. That ain't what the hell I asked you. I said, was it a good school? And what does that mean? Dr. Shelley, what does it mean to be a good school? It means their passage rate is excellent. What is the national passage rate for NCLEX? Because if you don't know that, how are you going to judge if this is a good school? The national passage rate for NCLEX in this country is 79%. So if your school's passage rate, and some of you tell me it was an okay or good school, I looked that motherfucker up and it is a 30% passage rate. That is not a good school. And that means that everybody in the school is going to be up here failing. So no, you're not a good school if you can't get your students to do what they went to your school for, which is to become a nurse. And you can't become a nurse unless you pass the licensure exam. So if your NCLEX exam, you failed it, what was the point of the school? Okay, so that's the deal. Did your school close? Is it on probation? Was it ever even accredited? Is it a new school? You got to understand that's a huge reason why you failed. Okay. Here's another one that I don't get to tell you very often, but I really want you to see under inspiring testimonies on my page that every single student that passed took their time. What does that mean? Well, you can pass this test if you run out of time. What you can't pass is if you go and you rush through the last 10 questions because you're scared you're going to run out of time. No, this test is all about quality, not quantity. So if you run out of time, I got at least 7 people in inspiring testimonies that will tell you they passed and they ran out of time. I can think of their faces and their names right now. So you need to go check them out in case you think you're supposed to be rushing through this test. No, baby, take your time. What does that mean? Well, when you do practice questions, and you gonna do practice questions, when you do practice questions, you need to kind of get yourself to the point where you're at 30 questions an hour. Okay, keeping up. Use 3 resources only, stick with it, don't change. What does that mean? Well, I do consultations all day long, and you guys have an average of 6 things that you're using all at once. Let me tell you what the 6 things are. You got your Mark Climax books out and the videos. You got your Archer and you're doing questions. You got your RN Mastery and you're trying to look at that. You got your Remark Quick Facts and you're checking that out. You've got your Simple Nursing videos and you're peeping that out. And then you got a whole nother Saunders book and you're looking at that. Find 3 good things that you like. Maybe I'm it, maybe I'm not, but you need 3, and you don't need to be all over the map, because here's what's gonna happen. You're gonna waste time. You don't have a methodology to get you to pass. There's no plan to get you to stick to the plan, stick with the process. What do we say? Don't let the process punk you out your purpose. Stick with the process. It's gonna get you a license, but you gotta be repetitive. You gotta master this, and you gotta do it one subject at a time. You can't be all over the map, and stop doing so many questions. Every little practice test you have should be small, little bite-sized pieces, kind of like quizzes we gave kids when they were in grade school. The questions should be no more than 5 to 25 little questions. You should never do a practice quiz with 85, 50, 60, 75. No, that's too much, because we want you to really learn it, not try to memorize it, and we need you to keep it small so you can look at the rationales, okay? Now, on that note, I'm sorry, you can shoot the messenger, but I'm going to keep it all the way 100 with you, because I'm the one with the PhD. I'm the one trying to help you, baby. I gave you my shit for free. So what you think? I'm going to mislead you about some software? Hell to the no. So here we go. Use UWorld RN, even if you are an LPN. I'm talking to everybody. It don't matter who you are. Use UWorld RN, because UWorld RN is the only software that I promise you is going to get you a license. It is. It just is. You cannot argue with UWorld RN. You just can't. And then guess what? They've changed the game completely. Not only do they have the excellent questions, which is when I swore by them when they didn't even have videos, but now they got videos. So they got videos, they got the questions, they got the analysis. Go ahead and get you some UWorld RN. Now, I don't care what you use. If you're hard-headed and you want to go ahead on and flow with the little Archer, I don't give a shit. If you want to go with Archer, let me tell you why I don't agree with Archer. It's too easy, baby. It's just too easy. A 60% on Archer is a 40% on UWorld. So that's not going to help you. But if you do anything, at least that's better than nothing. So if that's all you got, your money funny till you can get something better, it is what it is. But here's what I want you to do, no matter if it's UWorld or Archer. Do not go by their assessment, please. Let's just be common sense about this. This is what I tell my students in class. I say, baby, let's just go back to common sense, like common sense, not book, common sense. If you a teacher, you give your students a quiz, they get 100%, that's an A+. If you give your students a quiz, they get a 90%, that's an A minus B+. If you give them a quiz, they get 80%, it's a B minus C+. Everybody and their mom-in-law know in nursing school, 70% and below was a D. I mean, you failed. It was a D, okay? So why are these software telling you these two? I mean, it's a lot of software that does this, Kaplan on down. Why does the software tell the nurses, oh, you got a 69%, you have a really good chance of passing? Bullshit. A 69% is failing in anybody's common sense approach. I tell you, you need an 80, 85%, 80, 85% if you're an RN. If you are an LPN, look to get 75%, because after all, it is RN software. Why should the LPN not use LPN software? Because those questions are not hard enough. They don't have the EKGs that you personally need on this test. And yes, my LPNs will tell you, and I'm sure you already know, you got those damn EKGs and you didn't know nothing about them. Okay, so there you go. Now, study something pink every day. Something pink in my class is this, right? Something pink is the Oh My God packet, which is the study guide and a whole bunch of select alls and diets and nutritions and labs and everything else. How do you prioritize? How do you delegate? Whatever. That's in the Oh My God packet. It's pink. The next pink packet matches your candidate report. This is your management of care. That's number 2. The next pink packet going along with your candidate report, this is your safety and infection control. Now, you know we already talked about that. If we keep it moving, you see psych. Here's your psych. You study something pink every day. Your pharmacology, because basic care and comfort is in your oh my God packet and your procedures packet. But pharmacology is 2 different packets, one of which I just updated this year, 2024, this medication categories, and just the routine alphabetical pharmacology packet. So that's that. And then you have the almighty, this is the number 1 area of failure, procedures, risk reduction. That is right here. The reduction of risk and procedures has all of that stuff I told you that reduction of risk means. And there's some EKGs in there as well. Okay, now, so we say study something pink. And of course, those are discounted. They're on sale. But what if you don't have anything pink? That's okay. That's okay. Get you a 5-subject notebook and study these videos, because I have a million of these videos to help you. I have a ton of these. Everything you see here, I have that right for free on YouTube. So calm down. Okay, that's the study something pink, okay? Now, know your own risk factors. This is a big deal. You got to know your personal risk factors. Each person's an individual. You are not your friend. You are not your cousin. And if you're a family of nurses, I know you losing your mind because they didn't all pass and you failed and you just feeling some kind of way. But let me tell you, you got to know your own risk factors. Let's look at some of the risk factors because this is kind of interesting because I've had a time of 20 years analyzing this, right? Again, I've got the PhD. I can help you. Here we go. If you are English second language, you have the highest failure rate, and we just might as well put it out there because of the national passage rate on NCLEX is around 79%. The passage rate for the English second language is 49%, and it matters how long you've been in the United States. Was it more than 10 years or less than 10 years? Was it more than 20 or less than 20? Where did you come from? Was it London? Was it the UK? Or was it Haiti? It does matter. Currently, I get a lot of students from Africa, I get a lot of students from Canada, and I get a lot of beautiful students from the Philippines. And they're all really dear to me, and they are all passing. Are you an LPN or RN? Well, let me tell you about that. If you are a bridge student, which means you are an LPN first and now you're an RN, you have a really high failure rate because you are going to the test as a nurse who has usually worked in an area which is not going to be the way we practice on the test. In other words, if you worked at long-term care facilities, nursing homes, assisted living, that's not going to be anything in that facility or that place of work to help you on the test. But yet the LPN takes her work to the test. Even nursing assistants and medical assistants that have been that for years take their work to the test, and they find out quickly that is not what they do on that test. So this person also has a problem in the sense that they're LPNs already, they're nurses. So they work a lot because they're living large, bought the big ass truck, want the purse, all taking trips to Dubai and all this other crazy shit, but they have not slow down enough so that they don't have to work to pay all these bills and they can actually study. Thirdly, these beautiful students went to an abbreviated program called a bridge program, which means they skipped over the very part that's usually on the test. All right, so that's why they have a high failure rate. If you failed HESI and it took you repeated attempts, you are high risk for failing this test as well. People say, well, I finally passed it, so I know I'm ready. No, you're not. No, you barely passed, like you had to take it 3 times. And so, you know, you got to think about that. Did you fail any classes in nursing school? If you failed any classes in nursing school, you're really high risk. You're at risk for failing this test. Okay? What about your grade point average? It's amazing how many people don't know what that is. Did you get A's and B's? Did you get B's and C's? Did you barely get through and got all C's? Did you barely get through and got a couple of D's and had to take the class over? Your grade point average matters. If you got all A's, that's a 4.0. If you got all B's, that's a 3.0. If you got all C's, that's a 2.0. A GPA less than 3.0 is a little risky. Not as bad as some of the stuff above it, but it's a little risky. Were you pregnant when you took the test? Being pregnant in the first trimester, the first 12 weeks, or the last 12 weeks is the worst time to take an NCLEX. So if you're pregnant now and you're planning on taking an NCLEX, either have the baby or wait till you're between 3 months and 7 months to take your test. Life crises. I have talked to so many of you and you break my heart. You tell me your mother died in the middle of it all. You tell me your son was shot. You tell me that you yourself had a stroke. You tell me that dad had a problem. You tell me that your son got arrested and you were dealing with court. You tell me that you kind of went through a homeless period. You tell me all these things that tell me, oh my God, that's the worst week to be taking a test. Whew, so drama in the club, life crises, woo, reschedule that bad boy for 2 weeks to 2 months from the crises, okay? Now, let me just give you insight on what I deal with on a regular basis. Here we go. It's the last part of this video. When I talk to you on the phone, and either you are texting me for pink packets, which are on sale. We call it 8 for 88, 7 for 77, 6 for 66, 5 for 55, whatever you want. You know, or the, oh my God, it's just $35. So, you know, if you want a package, you're texting me. Sometimes you want the packet and you want a consultation. Well, I've done 1 million consultations with students, and I'm just going to tell you the facts because I've had a whole year to analyze this new test, and here's the facts. When I look at all the students who have ever talked to me about failing, 70% were English second language, okay? 60% of all the students I've ever talked to about failing, 60% were bridge students. 90% of you went to a bad school, and you know that that's probably true because COVID destroyed clinicals, and we have a nursing shortage of educators. And you guys tell me how your dean quit in the middle, your teacher, you know, did half a semester and disappeared out of nowhere, and then you tell me how one of your teachers was teaching maternity and pharmacology and didn't know either, and then you tell me how your teachers read off of PowerPoints, and then you tell me how you'd ask your teacher something, they tell you, go look it up. That means they don't know. 97% of the people that I talked to that failed used Archer. 20% of students that I've talked to used questions only, did not look at any content videos at all. So if you think about what videos are, you know, the videos on YouTube, those are content videos, and there's some really good ones out there. I may or may not be the best. I'm not going to act all bougie about it. There's some really good videos out there. I'm not the only one. Look at your freaking videos. Get a system, okay? Subject by subject, okay? 40% of the students that I talked to that failed took that damn test 45 days after they failed. Now that's ridiculous, okay? 60% were dealing with drama, and then 70% of the people that I talked to that have failed, they literally work too much. That's just facts. Now, can you pass your test with Archer, working 40 some odd hours a week, being an English second language student and a bridge student, and went to bed? Of course you can, nut. But I'm just telling you the risk factors, baby, because I'm trying to help you. So I hope this helped. I really want you to be okay and succeed. You do need to just reflect, what is it I could do better? And this should help you with that. But the most important thing is to just wait till you get your candidate report. If you do want me to talk to you, I will. If you need the pink packets, this is how you reach me. Don't call me because I ain't answering. Don't email me because I ain't answering that either. 216-410-0936 and text me. It's the best way to get me. But please give me grace, okay? Because y'all are on some BS. Think about it. I work at the hospital. I teach full time. And then there you are texting me, wondering why I ain't responded in 15 minutes. Are you serious? Come on now, give your girl some grace. It's going to take within 72 hours for me to get to you and get these packets to you. So chill. They come in your email. Stop sending me your address. I'm not coming to see you. Now, I would like to, but I can't. Now, just in case you didn't know, we do have an exciting 3-day boot camp here in Ohio, Cleveland, Ohio. If you're interested in knowing more about this 3-day Ngn Nclex review, you just call me and text the word boot camp and I'll get you the information. I hope this helped. Deuces. Love ya.